And good morning again. I'm Jennifer Kraus from the News Channel 5 studios. We are interrupting the regularly scheduled programming to bring you Mayor John Cooper's daily update, which is set to begin any minute now. There he is. His assistant is preparing to start that update. As he is telling us, we will be hearing from Mayor Cooper as well as Dr. Alex Jahanger, who is the head of Metro's coronavirus task force. Also joining the two men today, Dr. James Hildreth, who's the president and CEO of Meharry Medical College, and Dr. Jeffrey Balzer, who's the president and CEO of Vanderbilt Medical Center. Again, this is being held separated. Reporters are not actually there in the interest of public safety and social distancing. Looks like we are about to hear from the mayor now. Let's listen in.
Good morning. For some time, my administration, including Metro Public Health, has worked closely with the CDC to prepare Metro's coronavirus public health plan. We mobilized our citywide monitoring and response plan in coordination with area hospitals, healthcare providers, and medical colleges to keep Nashville and Davidson County on the leading edge of nationwide best practices when it comes to keeping our community safe. Now, we are now taking the next important step to reduce the spread of COVID-19 in Nashville. Today, I'm announcing that the Metropolitan Public Health Department is issuing Order Number 3, a Safer at Home order, which closes non-essential businesses and urges people to stay home unless they have an essential need. This public health measure is an extension of the actions we have already taken in the city to reduce public gatherings and contact. Many businesses have already altered their service or closed. Many Nashville residents have already decided on their own to stay at home and distance themselves from others. This order will further protect residents and support the work of our healthcare providers by flattening the curve of the coronavirus disease in our community. This Safer at Home order is reflective of a partnership with our healthcare providers. We are acting and responding to advice and requests from our healthcare systems. And I'd like to thank Dr. Jeff Balzer, President and CEO of Vanderbilt University Medical Center, as well as Dr. James Hildreth, President and CEO of Meharry Medical College, and himself an infectious disease expert, for their partnership and joining me here this morning. Now, under the Safer at Home order, all Nashvillians should stay at home for the time being, unless completely essential. If you must go out, we urge everyone to practice appropriate social distancing protocols, maintaining a distance of 6 feet from others whenever possible. Until further notice, all businesses not performing essential services will close for 14 days beginning at midnight tonight. Those performing essential services will remain open, and they include federal, state, and local government offices that provide core safety services, including public safety, grocery stores, convenience stores, and food banks, hospitals, clinics, doctor offices, and pharmacies, veterinarians, gas stations, banks, and other financial institutions. These and other essential businesses will remain open to provide valuable services and basic needs to Nashville residents. Unfortunately, non-essential services that require direct physical contact should be suspended. Businesses that deliver goods safely without face-to-face contact can be continued. You can find a complete list of essential services by visiting covid19.nashville.gov. The new policies announced today are similar to the best practices that other cities are enacting nationwide. Our food supply will remain strong, and our city services will continue to function as normal. I encourage everyone to continue shopping for your weekly groceries like you do now. There is no need to stockpile essential items that might be needed by your neighbors. Remember, we ask you to stay comfortably at home with your loved ones and remain socially distanced from others to protect yourselves and prevent the spread of the coronavirus in Davidson County. All public and private gatherings need to be limited to fewer than 10 people. Birthday parties, fundraisers, faith-based meetings, and similar activities should remain on hold until further notice. To the people of Nashville, to our amazing Nashville businesses, thank you. This is not easy, but it will also not be forever. We will return to our normal routines, but we must take these steps to get there. As always, I'm grateful to Dr. Alex Jahanger, chair of the Metro Coronavirus Task Force. He will talk about these new policies in more detail shortly. And as a reminder, you can visit covid19.nashville.gov for up-to-date public health information and for the status of Metro government services. You can also visit this website to make a contribution to the COVID-19 Response Fund, which is created with the help of the United Way of Greater Nashville to support Nashvillians facing hardships during this time. Please follow social media accounts as well, where we have very simple graphics that will help explain why this safer at home order and other actions are simply in the best interests of the health and well-being of our citizens here in Nashville. And with that, Dr. Jahanger, thank you.
Thank you, Mayor Cooper, and good morning, everyone. I want to start with an update on the coronavirus in Nashville. As of today, we have had a total of 179 confirmed cases, with a total of 1 confirmed fatality. That is an increase of 46 cases in the past 24 hours. The patients range in age from 11 to 73 years old. Of the confirmed cases, 2 are currently hospitalized. 149 cases are self-isolating at home and have mild and manageable symptoms. 27 people who were confirmed cases have recovered and are now cleared. As Mayor Cooper announced, today, Dr. Michael Caldwell, Director of Metro Public Health, will issue a safer at home order for all residents of Metro Davidson County for at least 14 days, beginning tonight at midnight. With the action we have already taken to limit public gatherings and contact, this is the next step to slow down the spread of the virus. Many businesses have already limited their operations or have closed, and many people are already staying at home. Today's action is to ask all residents of Metro and Davidson County to do the same. By flattening the curve, we will reduce the strain on our world-class healthcare systems here in Nashville. Here is the reason we've made the decision. Right now, we are all safer at home. Beginning at midnight tonight, all bar and restaurant on-site services will remain closed. Delivery, takeout, curbside, and drive-through will be allowed. On-site activities at hospitality, educational, fitness, sports, entertainment venues, and business facilities will close. Online activities, though, at these locations may continue. Hair, nail, massage, tattoo, and other personal appearance businesses will close. Public and private social clubs will close. Non-essential social and educational programs at senior citizen and assisted living communities will end until further notice. Gatherings of more than 10 people will be prohibited. City parks, however, will stay open. So now is actually a good time to go outside for a walk, take a jog, or ride a bike. But remember the CDC guidelines on social distancing and stay 6 feet apart if you choose to do these activities. Also, any business not performing an essential service will close. Essential services and businesses, however, will remain open. These include federal and state offices and services, including the post office, airports, Nashville government functions, including law enforcement, transportation, and businesses that provide government programs and services. Furthermore, food and beverage stores will remain open. These include grocery and beverage stores, big box stores, farmers markets, food banks, catering, convenience stores that sell food, agricultures, and other businesses that directly support the food supply. Here's also what will stay open: healthcare and mental health facilities, biomedical research and businesses that directly support the healthcare industry, sanitation and waste removal services, energy, water, and sewage services, pharmacies, businesses that directly support the drug and medical supply pipeline, gas stations, banks and all businesses that directly support the insurance and financial services sector, legal and judicial services, laundromats, including laundry and dry cleaning services. Home and business repairs and hardware supply businesses will also stay open, as will warehousing and storages. Construction and facility design businesses will stay open. Product logistics, transportation and distribution businesses, parcel transportation and delivery businesses will all stay open. Veterinary and pet supply businesses and services, home and business cleaning and maintenance services. In addition, daycare and childcare businesses will remain open. However, we urge these businesses to prioritize the children of parents working in essential services. Hotels will remain open. Food pickup and room service may continue. However, restaurants and entertainment venues at these hotels must close. Look, I know this is a lot of information to absorb. For more details and to answer questions you may have, please visit covid19.nashville.gov. I truly thank the many businesses and residents who have already taken these measures, and I thank everyone else who will continue to take these actions in the coming hours. I want to ask everyone in Metro and Davidson County to do your part. Stay at home unless you have to go to one of these essential businesses. If we follow this order, I am confident we will be safer at home. We will help flatten the curve and slow down the spread of this virus. As I continue to say, we are all in this together, and together we will make a difference. Thank you very much for your attention, and I would like to now introduce Dr. Jeffrey Balzer, President and CEO of Vanderbilt University Medical Center.
Good morning. Mayor Cooper asked me to be here to help provide context for what we think could be ahead for our city's and nation's healthcare system. We must make every effort now to slow the spread of this virus. We're all aware of the impact COVID-19 has had on other nations. China and Italy offer vivid examples of how swiftly the virus can spread. The hospitals in some areas of these countries were quickly overwhelmed. In the short history of this pandemic, we've already learned a lot about the nature of this virus and how we transmit it. One is that we can all spread this virus before we know we have it, before we have symptoms. That changes everything. The steps we need to take are very much different than simply avoiding people with symptoms. Even though our researchers here and across the nation are working as quickly as possible, we don't have a vaccine or an effective treatment. And we don't expect to have one over the next few weeks when the Nashville area will experience its peak in numbers of cases. So, our most powerful tool now is to slow the spread of this virus. Our most powerful tool to slow the spread of this virus is social distancing. That includes sheltering at home for people not working in essential service areas that the mayor has outlined. We do know this works. The evidence is clear from countries with outbreaks ahead of ours. And if we do this and we take it seriously, we will lower the pace at which people become infected. In healthcare, we call this flattening the curve. By following this public health order, we can reduce the number of people who need to be in hospitals all at the same time. We need your help to reduce the extent to which Nashville's hospitals are overwhelmed. We need your help to preserve precious healthcare resources to care for those who we know will require intensive care support for COVID-19. And we need your help to preserve healthcare resources for thousands who will, at the same time, need our hospitals for so many other conditions, like heart disease and cancer. Those diseases are not declining just because coronavirus is increasing. Yesterday at Vanderbilt, we had our first patient die from COVID-19. Vanderbilt University Medical Center strongly supports the mayor's statement and the plans he announced today. I can also say that the leadership of Metropolitan Nashville's other healthcare systems, St. Thomas Ascension, Nashville General Hospital, and Meharry Medical School, and many others represented by the Tennessee Hospital Association, are with us and support these moves. Thank you, and I'll now introduce President and CEO of Meharry Medical College, Dr. James Hildreth.
Good morning. Mayor Cooper asked me to speak this morning regarding the science that underpins his decision to impose the new restrictions. This virus belongs to a family of viruses that have a very high infectivity rate. The data shows that for every person who's infected by the virus, they infect on average 3 other individuals, which means that every 6 days, the number of people who have this virus could double unless we do something to stop it. As you heard from Dr. Balzer, we have no vaccine, no effective drug. The only tool we have in our quiver to fight the virus is to stop the chain of transmission. And that means, in this case, social distancing and hygienic practices that limit the contact with the virus. This virus can be transmitted through aerosols, and that's why we need to stand 6 feet away from each other. That's the social distancing. We also know the virus can live on surfaces for as much as a whole day. That includes plastics, paper, cardboard, wood surfaces. So we have to be mindful of our T-zone. All of us have a habit of touching our faces several times a day. In fact, some people do it several times each hour. And the T-zone refers to our eyes, the nose, and the mouth. These are the surfaces by which the virus can be easily transmitted. So when you touch a surface that's contaminated and touch your T-zone, you can in fact infect yourself with the virus. So by social distancing and by practicing these techniques of protecting our T-zone, we can limit the transmission of the virus. People need to understand that we've not dealt with a virus quite like this since 1918. An extraordinary virus like this requires extraordinary measures to stop it. So I fully support the mayor's decision to shut down the city for 14 days or to take these steps, because it's the only way we can actually stop the virus from decimating our community. And I believe personally, as an infectious disease researcher, that if we do this, we'll keep the health system able to deal with the infections. We'll also shorten the time at which our lives are disrupted like this. So please practice social distancing and stay at home and protect those that need to be protected from the virus. Thank you.
Thank you, everyone. We will now start the Q&A portion of today's briefing. As time allows, you can click the raise hand button next to your name. I will go off camera to announce your name aloud, at which point you may proceed by asking your question over the air. Looks like we do not have any questions from the media at this point, so we will make a video recording of this broadcast available to the press later today. So we will wrap up at this time. Thank you, everyone, for joining us. This concludes today's Metro COVID-19 press briefing.
So again, as you heard, that was the mayor's daily briefing from Nashville Mayor John Cooper, making a rather significant announcement today that he has ordered, along with the head of the Metro Public Health Department, order number 3, a safer at home order. He says that this will mean that all non-essential businesses will be shut down beginning at midnight tonight. He's urging people to stay home unless it is absolutely necessary that they leave home. Many businesses will remain open. The essential businesses, government offices, grocery stores, gas stations, banks, and of course hospitals, doctors, and medical facilities. He's urging people again not to rush to stockpile food, but again, all group activities are on hold for now. He says, reminds folks that this is not going to be easy, but this is not going to last forever. These are steps we must take now to protect each other. The latest numbers, 179 cases of confirmed coronavirus in Davidson County. That's up 46 cases just from yesterday. And as we heard from Dr. James Hildreth, one person infected can infect 3 others in just a matter of days. The number of cases can then double. We heard from Dr. Jeffrey Balzer from Vanderbilt, who said we must take steps now because we do not want to overwhelm hospitals and healthcare workers, and we want to have space in our hospitals to be able to treat the people who need the treatment. As Dr. Hildreth from Meharry said, this is a virus that we have not seen anything like this since 1918, and he fully supports the mayor's decision. Of course, this comes on the heels, as News Channel 5 Chief Investigative Reporter Phil Williams reported today, that 1,500 physicians sent a letter yesterday to Governor Lee urging him to order a shelter-in-place order for the entire state. At this point, Governor Lee has declined to do that, saying that is not his style. We understand, though, that he will be making some sort of announcement coming up perhaps at 10 o'clock or around that time. Not a press conference, but some sort of release, so you'll want to keep it tuned to News Channel 5, to our website, and on our Twitter and Facebook feeds for updates on that. But at this point, Mayor Cooper, again, taking the lead in this, taking the step of calling for a safer at-home order. All non-essential businesses closing at midnight tonight, and everybody in Davidson County being urged to stay inside. Of course, if you live outside Davidson County, still, again, as you've heard, the serious nature of this, that you too should probably stay in place. And as you heard, also the importance of social distancing, and also, again, good hygiene, washing your face and avoiding, or washing your hands and avoiding touching the T-zone of your face. For the very latest on all of this and the continuing developments throughout the day, again, keep it tuned to the News Channel 5 network, News Channel 5, and on our website and our app and our Facebook and Twitter pages. We are going to return it to regularly scheduled programming. Thanks for joining us.